Yes. So, good afternoon, everyone, and welcome all. As you all know, OCI has special interest groups on the Facebook. They are low vision, binocular vision, distancing optics, public health, and clinical optometry. So, they are free to join. We conduct monthly webinars for these groups, which you can join without any registrations or charges. So today we are having a special webinar for cortical or cerebral visual impairment awareness month. So September is celebrated as a CVI awareness month, and in the honor of this month, we are conducting this webinar. So my name is Harshada, and I'll be your moderator for today's webinar. So as we all know, CBI is it's not just a diagnosis; it's a daily experience that affects how individuals see or learn, move, and interact with the world. But with the right support, adaptations, and tools, people with CBI can thrive. So in this webinar, we'll explore practical strategies that can make a real difference in daily life, whether it's a classroom or at home or in the community. So our goal is to equip families and even the therapists and individuals living with CBI with usable guidance and introduce vision aids and adaptive tools which support functional vision and independence. So to give this talk, we have Ms. Dalia Patakadavan. She is a qualified optometrist with a bachelor's of optometry degree from the Vasan Institute of Ophthalmology and Research Center. She completed a long-term fellowship in pediatric optometry, binocular vision, and cerebral visual impairment at Narayan Nethralaya Eye Hospital, Bangalore, gaining advanced clinical expertise in the assessment and management of the pediatric and neurovisual disorders. Currently, she is serving as a consultant pediatric optometrist and CVI practitioner at Vision Eye Care Vision Therapy Center at Kerala, where she also holds the position of director. Her clinical expertise includes pediatric vision care, CVI management, amblyopia therapy, binocular vision, low vision training, and vision rehabilitation. She is particularly committed to the early identification and intervention of the visual impairments in children and individuals with neurological challenges, which are guided by a strong belief in the transformative role of vision therapy in enhancing functional vision and improving quality of life. So I would like to. So this is basically a recorded session, and after the session, she will join us for the Q&A session because of her health issues. So I'll just play the recorded session, and after that, we'll take the question and answer, which will be present in the session. Okay, let me just give me a 1 minute. I'll play the recording. Please let me know if you are able to see my screen.
Thank you so much, Team OCI, for
Is it visible? Somebody please message in the chat box. Is the screen visible? Okay. All right. Thank you. Okay, I'll just play it.
warm introduction. Good evening, everyone. Thank you for being here. Today, I am going to discuss about the topic which is most common and often misunderstood. That is cerebral visual impairment or CVI. CVI is the one of the leading cause of visual impairment in children, especially developed countries. Yet many children remain undiagnosed or misdiagnosed. CVI is considered as a unique condition is because it affects brain's ability to process the visual images what the eyes are trying to see. In this condition, ocular structures are apparently fine, but the brain is not able to perceive the images what eyes are trying to see. It affects children's interaction with the world, how they are walking, how they are learning, or even how they are emotionally respond to the visual input. As we approach, September is a CVI awareness month. It's a perfect time to understand what is the condition is and promote the early identification. We can provide the supporting option for the practical strategies for the CVI. Let's start with the what is CVA is. CVA is a brain-based visual disorder. It affects brain's visual processing area, especially occipital lobe and its connections. In this condition, the ocular structures are apparently fine, but the brain is not able to perceive the images. We are considering CVA is a spectrum of disorder because it affects the visual processing area of the brain. So every patient with the CVA experiences it in a unique manner. The severity of the condition we can predict by depending the location and the extension of the brain damages. Importantly, a patient with the CVI, they are able to see, but they are not able to interpret what they are seeing in a consistent manner. So this inconsistency is termed as the hallmark of the cerebral visual impairment. Here are some of the causes of CVA. Causes of CVA are actually diverse, but most common causes of CVA is linked with neurological disorder, any kind of developmental delays, or any kind of early brain damages during the early stages of brain development. And here are some of the most common causes of CVI, which include hypoxia. Hypoxia means lack of oxygen availability to the brain before, during, or even shortly after the birth. And hypoglycemia. Hypoglycemia means a decrease to the sugar level in the body. Hydrocephalus, increase the cerebrospinal fluid inside the brain. So that fluid compresses the visual pathway, may leads to cerebral visual impairment. Periventricular leukomalacia. Periventricular leukomalacia is the one of the white matter damages affecting in the brain. The most prominent in the patient is born with the prematurity, and or is there any kind of genetic disorder, any kind of brain injuries also causing CVI. And if the patient have any kind of epilepsy seizures, or if the seizures arising from the occipital lobe, CVI will be one of the reason for that. How a CVI patient experiences the world. We can't say like that a CVI patient is seeing the world in a fully blind manner. It's not like that. They can see, it's not only just a blurry vision. What they are seeing is a confusing, incomplete, and overwhelming manner. So every patient with a CVI perceiving the world in a different angle. So here are some of the most common presentation of how a patient with a CVI explore their world. Here you can see a patient with sitting around a cluttered environment. So patient is saying individuals are describing that they are unable to find a familiar object among a distraction. Even if it's a familiar place, also their children have the struggle to pick the familiar objects. It's because they are fully confusing, so they are not able to pick an object from the clutter or from the messed surface. It will be more obvious when we are mixing the things or their toys in other, or we are keeping their toys, food or something in a patterned surface. So patient feel confusing, so they are not able to pick the object from the cluttered environment. And another main criteria or a main problem they are facing is face recognition. Patient with the CVI have the difficulty to find the face of their family or friends or even their close to ones. They are feeling like it's kind of blurry or patchy. So people with the CVI rely on the voice, hair, clothing, or other non-facial cues to identify the people. Why they have the problem with the face recognition? Most of the CVI patients have the problem with their contrast sensitivity. So they are not able to appreciate the eyes from nose from lips, and the differentiation will be difficult for those. That's why they are relying the non-facial cues to understand their closed ones. And another problem they are facing is visual field damages and focusing problem. So they started to ignore or unaware of the things in a specific part of their visual field. They will only notice a specific things, or they will notice the things on the right or left. For example, if they have a light field effect, they will consider everything on the right side. If even food also, even any kind of academic activities, walking, everything, they will consider the things on the right. They will left over like that, whatever things are on their left. For example, they will be left over the food on their left side. They will be unfinished their academic performance on their left part. They frequently they will be started to bumping on the object on the left side. You can notice it will be more prominent if the patient is walking in an unfamiliar area. So you can notice that one their navigation will be extremely slow in an unfamiliar area. It's because they're unaware of the things what all are there. So they have that fear of bumping into the objects. Even if it's a familiar place or in their room or their home, they know what all things are there. So they can at least manageable, but it will be difficult for them. CV patients have their own specific preference. For example, like preference, color, contrast, movie. So some of the patient with the CVI, they are extremely sensitive to glare and they are extremely sensitive to light and all. So they will started to cover their face or they will be look away from there. But in another category of people, what they will do, they will be very fascinately looking on the things on the like a particular light source. They will be most of the time they'll sitting in front of the windows. They will be looking on a specific object most of the time. Uh, uh, Patient with the CVI also have a different approaches towards the moving object. Some of them are avoiding the moving things and they started to scream badly because they have the difficulty to track that moving objects. And but other category of people, they will be very attractively, they will get a good attention while something is moving. If we are giving anything static, they don't have a proper approach or they don't have proper attention. If something is moving, they will get a good idea or visual attention on the moving things. And here you can see the attraction to colors. CV patients have some color preference. Some of them is preferring a bright red color, bright yellow color. So if we are giving other than that, patient won't be a respond to that. So they will be ignore the things. If you are giving a specific color according to the patient's preference, they will started to looking, they will get a good visual attention also. If you know the patient's preference, according to that, we can manage the condition also. Here you can see in academics and all, patient, you will notice that patient will read everything will be slowly. They will be started to irritating if the pages are crowded or they have a busy worksheet and all. If you can understand that one, if you're giving high contrast or large print or clear spacing, patient will be experiences it in a very good manner. Patient can do the activities very nicely. Visual fatigue is one of the effortful process, so patient needs frequent breaks while doing the visual activities. So if you are giving any academic activities, child tire quickly using their vision and they will started to irritating, they will started to less engaged towards the visual activities. So parents are often think like that patient have some kind of learning disability. Even teachers also thinking he doesn't have any kind of interest over academics and he has poor cooperation while academic performance and all. The caregiver observation also saying the same like that short visual attention span. If we are giving any kind of visual activities, even to play or even in academic performance also, they have a poor responses. Once a few seconds, they will be started to the visual activities or any kind of works. Immediately they want to break or they will be irritated badly. Parents are complaining like that my baby doesn't have proper eye contact or little eye contact. Once I call his name, he started to respond. If I'm passing in front of him, he doesn't going to mind me. Which means parents are thinking like that these are the behavioral issues, but they are not thinking these are the problem of vision. Once he is calling means he is responding to that auditory clues. It's not about his vision. And a tactile exploration means if we are giving any kind of toys, he started to stimulate over there. He started to rub on his face, his body, and all. Once we prevent that one, baby will be scream very badly. If we want to give any kind of toys or any kind of things, patient wants to respond means for startingly he keep his head in a particular posture, then only he will be look at the objects. That means he will keep a particular head posture. So parents are thinking like that they have a problem with their behavior issues, they have some problem with their learning problem, so they are thinking they are not going to be understand it's a problem of vision. It's all about their behavioral issues and all. I can explain it in another way. I am telling you people to go and grab a banana from this group. It will be easy for you, right? You are going, you can grab it easily because everything is elongated and look like yellow. If I am telling the same thing to a CVI patient also, it will be easy for them because there is nothing to confuse, right? I am telling the same thing you to go and grab a banana from this category. It will be very difficult for a CA patient, but for you it will be easy. First, what you will do, you have to scan from start to end. So you have to search everywhere. Then you got to know that here is the banana. How you go to know that one? You are segregating every frozen vegetables from banana because you already have that experience and you are separating all the objects from this thing. So it's a red apple is red in color, it's not a banana. It's a cone, it's not a banana. It's a cauliflower, look like a flower and a white in color, it's not banana. Here is the banana, right? How fast, how quickly you are doing the thing. If I am telling the same thing to a patient with a CVI, what they are doing, they also do the same thing. They started from beginning and they start to scanning everywhere and they will be confused. So they are thinking because it contains lots of cognition, right? Different colors, different shapes and all. Patient are thinking like that they are started to differentiate the things from banana. It's watermelon, it's not, it's green, it's not banana. It's cauliflower, it's white in color, it's not banana. So where is the banana? So here are lots of yellow. So they wants to be differentiated. So many yellows are there. So they wants to differentiate these things from the banana means once they reach it to banana, obviously they will be tired. They will be tired quickly. Why? Because much more cognitive tools are there. So once they reach it to banana means they are completely tired because their visual processing is extremely slow. So what will happen? They will be started to irritate very badly. They will be scream. So they want immediate break after even a short visual attention or a short visual task and all. So parents are might think it's a behavioral issues. No, it's not a behavioral issues. These are the real sign of how a patient with a CVI experiences the world, how the brain is making uh, the struggle to see an object properly. So consider it as it's not a behavioral issues. These are the real sign of how a patient with a CVI try to see the world. Now we got an idea about what a CVI is, how a CVI patient explore the world, how much struggle they are taking to see the world, right? And after listening the patient's experience and the caregiver's observation, we got a proper idea about the patient. This idea helps the professional to create a better assessment and do a holistic, proper management option for the patient with the CVI. So empowering a patient with a CVI is not about restoring their lost vision. It's all about optimizing their residual vision they have. How a patient with a CVI use their current vision, how we can enhance the vision, right? So CVI means it's a brain-based visual disorder. Every patient experiences it in a different manner. Obviously, the management also individualized, adaptive, and multifaceted, which depends upon their social interaction and their experience. Here are the most common. management option of CVI, which include low vision devices, assistive technologies, environmental modification, vision therapy training, and rehabilitation, multidisciplinary approach, educational adaptation, and family and caregiver support. Let's start with how a low vision aids are playing in CVI patient's life, right? Low vision aids plays a transformative role in the life of CVI, which helps to maximize their vision and support their independent living and improve their participation in the academic performance, like enhancing their functional use of vision, reducing vision clutter and complexity, support reading and writing and academic success, enable greater independence in daily livings, and improve mobility and orientation. Here you can see a few of the low vision devices like magnifying glasses, stand a magnifier, a handheld magnifier, right? These are the optical devices which helps to magnifies the print or the textbook. So it provides patient to easy to do their task. It reduces due to their magnification. It reduces the crowding for the patient. So it will be easy to patient to manage their academic performance. It will be easy for them to read and their academic tasks and all. Here you can see video magnifiers and screen reader. It has their own adjustable features. I mentioned before CVA patients have their own preference like color, contrast, light magnification and all. According to the patient preference, we can adjust the features of the devices. It enhances the patient's performance. It increases their confidence and motivation. Here you can see the tactile marker seen in the footpath, step and all. It provide improve their mobility of the patient. So patient get an idea about something is there or this might be the footpath, this might be the steps. Patient will get an idea about that one, means patient will get the confidence to live independently. Patient will get the confidence to walk in a busy environment. It enhances their functional vision and the quality of life. This reading lamp, tinted lenses and filters play the good role in the life of CVA patient. It helps to enhance the visibility and reduce the glare. Patient with the CVA, some of them require bright lights, some of them doesn't require that much. According to patient preference, we can adjust their light so it improves their visual attention. Patient with a CVI, some of them have a good performance at a particular contrast, right? So we can provide them tinted lenses or filters. It increases their visual processing also. And another empowering technology is assistive technologies. We are considering assistive technologies much more effective than the others. It's because it helps the CVI patients by personalizing their needs and customization will be provided. Every patient with a CVI have their own need, their own preference. So this technologies helps to individualize their various needs and helps to fulfill their various needs. So assistive technologies are much more effective than the others. And multisensory approaches means we know that 140% of our brain using for the visual processing, right? The remaining 60 is using for the other sense organs. We can combine the other sense organ to the visual processing, like we can provide visual stimulus along with the tactile clues, or we can provide visual stimulus along with the auditory clues. It enhances our visual processing little more faster. And why assistive technologies are most preferable means it is very socially acceptance and easy to portable. Patient with the CVI, we can say that if we are giving them a low vision aids, they will work in a society. They are using kind of magnifiers, telescope, that kind of mounted spectacle mounted glasses. Patient themselves feel like that some of the insecurity inside over them, right? If you are comparing low vision aids to the assistive technologies, the advantages is we are using the assistive technologies as smartwatches, smartphone, headbands, like that kind of devices. So it provide a modern look for the patient and it will be socially blended very easily. So patient will give that confidence. I am not using that kind of the things like low vision and all awkward things. But this also everyone is using in this modern era, so patient will feel much more comfort while using the devices also. Here you can see the screen magnifier reader software. These are the devices which helps to magnify the print little more bigger. So it is easy for the patient to read. It helps to reduce the crowding. Once the patient is tired, they are not able to read it properly, means the device itself trying to read it loudly. So it helps the patient to reduce their vision fatigue. Here we can see the video magnifier. Video magnifier have filter distraction according to patient preference. We can set that. So among this, which contrast patient can perform better, we can preset that contrast. Then it helps to reduce patients' clutter also, to improve their academic performance also. And another device is tablet, smartphones, and all. Patient is some of the patient with the CVI, they have a physically challenged, they have a poor gross motor skill and fine motor skill, right? So this kind of devices help them for the touch property. So it is not required that kind of gross for fine motor skill. It describes the scene what they are trying to see. If they have a difficulty to read, the device itself trying to read it loudly. It is easy for the patient to carry, and even it's using also. Here are the wearable technologies like smart glasses, headset, smartphones, and all the things. It provide a live magnification for the patient and contrast also. It can provide a real-time navigation. That's what it act as a mobility aid. If while wearing the devices, we are walking in front of in a society or in a busy environment, the device itself saying some objects are there, you have to be divert your pathway if any kind of obstacles are there. So it helps for the object identification before thinking, because we have the problem with the slow visual processing, right? So before thinking, as the device itself help us to understand the device is, identify the device is. So we have to change our navigation. It provide much more social confidence for the patient. So they will be much more socially interactive. Nowadays, everything is taken over by AI, artificial intelligence. It has a crucial role in the CVI patient's life also. The device helps to recognize the object. For example, in an environment, in a cluttered environment or something, it will be difficult for them because much more cognitive task tools are there. It will be difficult for the patient to understand the things. Then they will be the device itself saying like that there is a chair, there is a tree kind of things. It will be easy for the patient to understand. And if what they are seeing in front of them, the device itself immediately helps the patient to see the object fully clearly. If they wants to read anything, but he kind of medicine labels or something like that, but patient is not able to see properly due to vision fatigue or due to any kind of crowding, the device itself trying to read it loudly for the patient. If any kind of obstacles are there in front while navigation, this device helps to highlight the navigation, and it tell the patient to divert your pathway. So they will get that confidence. They can reduce the bumping on the objects if they have any kind of visual field defects. They wants to pick an object. Before I mentioned, patient will feel confusing to pick an object among a cluttered area, right? If we want to pick an object among a cluttered area, this device helps to provide a outline for the patient what needs to be taken. Suppose if the patient want a particular toy, we are giving a proper outline, the device itself giving a proper outline for the patient. Patient can go and grab the things immediately. Here are the environmental control system. These are the electronic system which helps the individuals to control their daily doing devices like switch, fan, AC, even door also. In we know that when the Alexa and Google Assistant, these all are the devices help us to manage ourselves. We can operate the device by voice control, touch switch, or even our eye gazes also. It provide reduce the visual clutter also for the patient and the independent livings. And another one is auditory support tools. These are the special sound cues or auditory signals. Once we are finishing any activities or once we are going to do any activities, the device itself is giving a background audio signals. So the patient will understand it immediately what is going to be happen. Suppose, for example, if any kind of toys or the patient wants to pick their toys, if the toy have a specific sound, it will be easy for the patient to grab the thing, right? So we have to incorporate other sense organs along with the visual stimulus to improve our visual stimulus, our visual processing. And another one is virtual reality. Virtual reality is a computer-based um, system, so we can provide it a real world stimulus. It helps the patient for their assessment, rehabilitation, and even training also. It can provide tracking, fixation, and decrease the clutter of the patient, and slowly we can incorporate the complexity while giving therapies, and it can act, we can cooperate this one to the other multisensory organs too. And another technique for empowering a patient with the CVI is environmental modification. So environmental modifications are the cornerstone of the CVI management. It helps to overcome brain-based difficulties. So we can change the environment more accessible and comfortable according to the patient's preference. It improves their functional vision also. How we can guide a patient's environment? Starting, we have to do declutter. How a patient experiences the world, starting only I mentioned that one. If the environment is much more cluttered, patient feel confusing further because they don't know among this much things how I can pick an object. If it is decluttered, there is no unnecessary decorations and pattern. Is so it will be easy for them to scan everywhere. Even if it's classroom also, keep their own required textbook pen. Even if it's the same color, though, it will be easy for the patient to grab because there is no confusion, right? So we have to provide visual, minimal visual overloaded, which helps to enable focus little more better. And patient, if I am giving, for example, in this picture, I am giving a patient simply feeding, so patient can do it, right? If I am giving feeding along with the visual stimulus, what will happen? Patient will get an extra visual attention. So we are stimulating their visual pathways. According to that, patient have, some of them have a bold contrast, they will respond nicely, solid colors and background. So we have to help the patient, or we have to understand the patient preference. According to that, we can create the surroundings like that. Like preference, if a patient need extra light, means what all are the activities they are doing, we have to provide them extra light. It helps the patient to avoid crowding by the shadows and all. It reduces their visual discomfort also. If we are giving anything to the patient, try to make it simply. Give one item at a time, one word at a time kind of things. For example, if I want to teach my patient like cognition, yellow color. So don't mix every color together and don't tell like that this is the yellow. No, it's not like that. We have to give even a single color. Once the patient is thorough about that yellow, slowly we have to introduce another color. For example, a red. So we have to compare this red and yellow. Once patient is understood that yellow from red, then only we have to introduce another complexities. So start everything as a simple manner, give one by one. It will be easy for the patient to grab, easy for the patient to understand. In a home and even classroom, everywhere, we have to organize their things. If we are organizing the things, means it will be easy for the patient for their navigation. For example, I kept my things on my cupboard or my wardrobe. It is easy for me to go and take. I know this rack, I got my books. This rack, I got my shirts. This idea provide them independent living. This idea provide them much more confidence about that one. So they will think like that I can do my things my own because it's already arranged things. They already everything is organized. So there is no confusion. So we are trying to confuse their environment. It will be easy for them to grab and do their activities. Patient with the CVA have their own specific visual field, right? Because due to visual field damages and all, if you are doing as a teacher, you are doing a particular task for everyone same like that, patient is may not be able to see that angle. So we have to understand which field of vision is patient is performing nicely. So we have to check patient's preferred visual field. We have to give a task according to that. So patient can get a extra interested to do the activities. They will be engaged much more in their academic performance and it improves their vision success also. Now we discussed about some of the
Just sorry, due to the network issue, I lost the connectivity. I'll just share the screen again and with that slide.
So we have to understand which field of vision is patient is performing nicely. So we have to check patient's preferred visual field. We have to give a task according to that. So patient can get a extra interested to do the activities. They will be engaged much more in their academic performance and it improves their vision success also. Now, we discussed about some of the empowering tools, kind of low vision aids, assistive technologies, and environmental modifications, right? These all are the techniques which help us to enhance how much vision they have or how to manage their daily life, how to improve their functional vision, right? Here we can going to discuss vision therapy and training. So how vision therapy is different from the other means it helps to improve the vision itself rather than enhancing their vision. So vision therapy activate and strengthen the brain's visual pathways by presenting targeted and engaging visual inputs. We have to give extra visual stimulus in a frequent structured manner. It improves the patient's vision. It stimulate the patient's neuroplasticity. In neuroplasticity, what will happen? Brain have the capacity to rebuild or reshape. It has the capacity to make the strengthen their neurons by the frequent stimulus. This neurocapacity is maximum effective at its childhood and early life of the patient. So we have to understand the patient condition little more earlier. We can give vision therapy little more earlier, which improve, maximize their functional vision. We can provide vision therapy according to the patient's need and according to the patient's performance. How we start a vision therapy? We have to understand patient's preference. At the time of assessment, we have to understand what are the preference of the patient. Before I mentioned a patient with CVA experiences the world, right? So some of them have a good response towards moving object. Some of doesn't have response. Some of doesn't have interest on moving things. Some other have a bright color preference. Some other have a red color preference. So we have to understand what is the preference is. We have to focus on that visual stimulus, reduce the visual clutter, give a simple things starting. In this picture, I can show you that the environment is fully black. There is no other distraction for the patient. Here, the moving object is completely moving. Nothing, if nothing is there around the patient's background. Here also the same. I am focusing a particular light source over an toy. Patient is focusing on that one. There is no other things for confusing for the patient. We have to give starting a single visual stimulus according to the patient preference. And slowly we have to repeat the vision stimulation. We are doing the therapy frequently. We are doing therapy structurally. Every day we are giving the proper visual stimulus means that the regular visual practice means it improves it strengthens the patient's neuronal connection and it leverages the brain's ability to perform well. Systematic and individualized approach is required. For example, my patient preferred yellow colors, means starting I give yellow itself only. Then once patient is able to understand the yellow, the moving object, we started from there. Slowly we have to introduce the other color. Slowly we have to introduce the complexities. For example, among yellow, I am introducing a red color. So patient has to differentiate the red and the yellow. Like that, slowly I am introducing complexities. Then we have to check, we have to assess how a patient responding with the colors. Build visual skills step by step. Slowly, starting with the single visual stimulus, and slowly we have to introduce other things, and slowly we have to change the background also. Then how patient is responding to the clutter, how the patient is responding to the new environment. If distractions are there, how a patient will be responded towards that one. We have to understand, then we will get an idea about how to improve their visual task. Here are the examples of visual stimulation. For example, my patient is required a red color, means starting I am showing him a red color. So you can see that one patient is how nicely patient is showing this visual task, how much visual attention patient have. Once the patient can do means we have to start with the visual stimulus. And another one is slowly we have to introduce other color. In this case, patient is preferring light. So starting I give a single target, patient will be respond nicely. Then slowly I am introducing another task also. Here my patient is preferring black and white stripes much more better. Performing well with the black and white board means I am giving therapies over black and white board. Here the patient is preferring light itself. Slowly I am introducing other objects, other tasks. Then the patient started to pick the things. In this picture, you can see the environment is dim illumination is there. Patient can notice only his face on the mirror, right? What will happen? They're smiling, that movement over the motion. Patient can perceive from the mirror. So patient will get an understand about, yeah, something is moving. They will do the same thing frequently. So it will be easy for the patient to grab the moving things. Here, if I am giving feeding for them simply, patient will do the same. Along with that one, I am giving extra visual stimulus. We can improve the patient's visual attention also. See, this patient is preferring only black and white stripes, only black and white background is there. Patient can get the good visual attention over the black and white stripes only. So what I did, I gave therapy over the black and white stripes. So patient started to pick the object, patient started to do the puzzles over the things, and slowly I changed the background. So which doesn't matter for them, which is not going to be distract the patient. Through the vision therapy, we can improve their visual attention of the patient. We can reduce their visual fatigues. It reflects their academic performance and their real life also. What all are the modifications we can change in their academics? We have to understand how a patient is experiences, how a patient with a CVI explore in their academic performance. For example, if we are giving high contrast material, it will be easy for the patient to grab. We have to give them clear and uncluttered pages. Very pure and neat, uncluttered pages give patient limited cognitive skills. So it will be easy for the patient to pick the things and try to write and much more things, and complex worksheet and all will be difficult for them to due to their crowding. They will feel confused. So if you are giving uncluttered, cleared pages means easy for them. We have to give simple background. So if you're giving us almost similar colors, we are giving a specific things like a required textbook and pen. Patient can do it immediately. There is nothing to confuse, right? We have to understand patient's preferred field. We have to give task for them according to patient's preferred area. As a teacher, we have to understand the visual processing takes time. So we have to provide them extra time for the patient. It will take much more time because never consider the other child with the CVI, other child with the CVI. If you are doing so, patient will be demotivated because other patients can complete finish their academic performance very easily or very quickly, but for them it takes time. So we have to consider their struggle. We have to understand how much struggle they are taking to see the object, how much struggle they are taking to do even a single task. That's why we are giving them extra time, extra consideration for them, for their small activities, for their small academic performance. Also, we have to provide them big motivation. It will be easy for them. They never feel I am alone, I can't do it. No. If we are giving extra motivation for them, they can perform well in the society. They can perform well in their academics also. Understand the condition of a CVA patient, and we have to give them real object and multisensory clues. I mentioned before that if we are giving anything for the patient, we have to incorporate visual stimulus along with the other multisensory clues. For example, if we are giving any kind of sensory clues, we have to give combines to tactile also, tactile feedback also, auditory feedback also. Then patient will get an extra idea about something is happening. If any kind of visual stimulus, if we are giving any kind of visual stimulation also, patient will give, suddenly it will be difficult for them, right? I am incorporating any kind of tactile clues, patient can grab it easily. As an optometrist, our work goes beyond the visual acuity, measuring the visual acuity. We must assess the functional vision of the patient. It is essential to recognize some behavior seems like learning disability or any kind of attention deficiencies and all. If you are aware of the condition of CVI means, then only you can provide timely diagnosis and early intervention of the patient, right? So low vision aids are one of our contribution from recommending referring from low vision aids to we have to guide them for the environmental modification. If needed, we can send them for CVA practitioner or other multisensory cues for their comprehensive care. If you don't know the condition or if you are unaware of the condition about CVA means, obviously you will be misdiagnosed it, right? You are thinking like that, these are some behavioral issues. So you are not going to be considered it. So most often patients are or parents are sharing their story like that. No one didn't identify the condition early. If they could means my baby can do it well. So never be like that. Be aware of it's our responsibility to the our responsibility to understand what a CVI is. It's our responsibility to provide maximum support for the patient with the CVI. If you don't know the condition means, if you are misdiagnosed with the condition means, we are denies a patient's right to see the world, right? So be the part of a holistic approach. Try to enlighten the vision in the patient with the CVI. Okay. Thank you so much. If you have any kind of queries, you can contact me via mail.
Yes, I think Dalia has joined us. Dalia, could you please switch on your camera?
Yeah, 1 second.
Yes, thank you so much, Dalia. In spite of having, health issues, you recorded the session for us, and now you're available for the question and answers. So thank you so much. It was a wonderful session. You covered
Yeah.
everything right from, environmental modifications, role of optometrist, everything. So thank you so much for being here with us. We'll take few questions.
Thank you, Team OCI, for the wonderful opportunities as well.
Thank you so much. Okay, if participants have any questions, they can put it in the chat box. Okay, we'll take a first question. What are the common misdiagnoses within our profession? Uh, I think the question means how it can be misdiagnosed, or what are the other differential diagnoses for the CVI?
Yeah. Yeah, exactly. I understood the question. If the patients are coming to our clinic, what they will think like that, some of them can read everything well, but the our clinicians are thinking like that there is no vision problem like that. But we can notice they have some behavioral issues, kind of learning disability. They are not reading properly. They have behavioral issues. So we clinicians thinking like that it's a behavioral issues. He can see everything nicely. Because we have to understand, if you know the condition of CVI means we have an idea about this is because visual struggle. They are not able to see it properly. That's what it is reflecting as a behavioral issues. If we don't know the condition means it is misdiagnosed as behavioral issues, autism spectrum disorder, ADHD, learning disabilities. It may leads to like that kind of way.
Right. Any other questions from the participants? How to achieve eye-hand coordination in small CVI patient? CVI.
So we have to start a proper assessment before giving therapy for the patient. While giving the patient therapy, we got to know about the idea about how the patient is response to our visual stimulus. So giving a full vision is not our criteria. We can't give a kind of a false hope to the parents also. Our aim should be we have to make the patient independent living. So we have to try for that. If a patient is not able to do means we have to provide rehabilitation techniques to make the patient live independently.
Yes. Okay. Dipali is asking, how do you access which tool do you use? Okay, how do you assess functional vision and which tools you use for that?
Yeah, while doing assessment of the CVI, it's a different part. It contains lot of criteria. So we can introduce the visual function and functional vision as well. These two are the two different criteria. The visual function means we have to check the patient's visual acuity, contrast sensitivity, visual field, stereopsis, all this kind of the calculated values we have to check by clinical tools, by Leah paddles, Leah bands kind of things. But functional vision, it's a random technique. We can do the estimated value. We can't understand how a patient is performing to this one. So it doesn't require a proper clinical tool. We can provide them a simple task, how they are responding to the colors. Even if we want to check the stereopsis also, we can assess their functional vision by grabbing a ball or stalking the blocks. That kind of simple puzzles also can provide to understand the functional vision of the patient. So in functional vision, we can check the patient's visual attention and how they are tracking and how they are responding to their all the visual field. This kind of things we have to check randomly.
Right. Yes. Okay. Take a next one. Okay. What are the rehabilitation techniques for the CVI patients?
Rehabilitation techniques, we can say according to the patient's preference and according to patient's response. Some of the patients, CBI have good response with a particular specific their visual field. Some of them have a good contrast. In some CBI patient, they have better clarity of vision, but it denies their visual field and all. So according to the patient's preference and according to patient's performance, we have to provide the patient to enhance and rehab their functional vision of the patient. It improves their daily life.
Yeah. Okay. We'll take a next question. So, as you mentioned, stimulate neuroplasticity. So, can we work same like how we treat amblyopia patients?
Yeah, obviously. So in amblyopia, there is no specific cause, right? It's an there is no specific organic cause. So we are stimulating the visual pathway. It improves the visual connections, strengthens. Like that, we can improve the vision of the patient. Similar like that, we have to improvise their visual connections of the CVI patients also. If you are giving proper vision therapy, it may leads to improve their vision from no eye contacts to good visual acuity.
Right. Thank you. Okay, what are the basic instruments or the devices which are required in the clinic for, to go with the CVI assessment?
For CVA assessment, every patient with CVA experiences it in a different manner. So it depends upon the patient's age, patient's condition, and how they are behaving like that. Some of the patient with the CVA, they have a good cooperation means we can do Snellen chart to assess visual chart. We can do contrast sensitivity by Pellier Robson and all. If they are very infant and newborn babies, we have to do TAC for their visual acuity. We can check Leah paddles. We can check hiding Heidi for their contrast, Leah band to check visual field. That kind of things we can introduce according to the patient's preference and according to the patient's response.
Right. Okay. Um, okay, what difficulties do you face when the patient referring to the other specialists like occupational or physiotherapist, etc. In case required, do they refer back to optoms with CVI specialty or it goes to the ophthalmology department? Okay, so they mean if the patient has been referred from occupational or physiotherapist, do they go to the ophthalmologist or they come to the optoms or what kind of difficulties you face in
Yeah,
such
understood,
reference? Yeah,
understood. Yeah. Yes, understood. So first, if occupation therapists are referring to us means they have any kind of suspicions like that the patient have some CBI features or what. So we have to give a proper thorough assessment by doing a detailed history taking. Then only we will get understand is there any strong suspicions for CBI or what. If we have any kind of doubts like that, we have to refer the patient for after our assessment. We have to send the patient for an ophthalmologist and even neurologist also to confirm the condition is CVI or not to understand by doing a neuroimaging. Then we can understand we can confirm that the condition is CVI.
okay, but do the ophthalmologist send back the patient to optoms for therapy or
Yeah, obviously yes. Yeah.
look at it? Yeah.
So once we do proper assessment, we have then we have to send the patient for ophthalmologist. Means the ophthalmologist can rule out is it pure CBI or what is there any preventable or ophthalmic conditions are there or what. To confirm that one, we have to send the patient for an ophthalmologist. After they are confirming that it's a kind of CBI, we have to confirm by a neurologist, neuro specialist also. And after that, they will send them back to an optom or send them back to a CVA practitioner to give a proper therapy and proper management options.
Right. Okay. Do you categorize the CVI by range?
It depends upon some others are saying we can categorize the CVI in a different criteria. But actually, what in my practical experience, we can't categorize the CVI in a different manner because every patient with the CVI experience in a different manner, which depends upon the area of the brain damage and how much extension the damage is. So every patient with CVA have different preferences, different experiences to the world. So there is no point to categorize the CVI. So we have to understand the patient by their assessment. According to patient preference, we can give the management option and empowering options also.
Right. Okay. How does CVI differ from delayed visual maturation, DVM?
Yeah, means before I mentioned like that, we can confirm the condition of CVI after doing a neuroimaging and all. So, is there any the brain damages or something is noticeable, or is there any history of seizures or any kind of delayed birth to cry? Is there any kind of brain damages are noticed from neuroimaging? We can diagnose and we can confirm it as the condition is a CVI. If in delayed maturation there is no such kind of organic causes while doing neuroimaging, then we can understand it's not a CVI, it's purely by the delayed development itself.
Okay. Okay, that's great. Okay, can vision improve with increasing age?
Can vision improves with increasing age means I mentioned in my presentation neuroplasticity have much more effective in the early life of period, right? So same like that amblyopy therapy we are telling like that we can improvise their vision even if it's adult also. Adult amblyopy also can be treatable right now. Same like that if we are giving a CBI vision therapy also can improve the vision, but the chances of occurrence will be different.
Right. Okay. So there are no more questions, and it's 4 o'clock. So thank you, Dalia. As we have come to the end of the session, I would like to extend a heartfelt thank you to all of you who joined us today, and a special thank you to you, Dalia. In spite of being having some health issues, you were able to conduct the session, and you answered all the questions beautifully. So special thank you to you, and for sharing your knowledge, experience, and of course the practical tips what you gave. To make a difference in our daily life of the
Thank you
individual.
so much, Team OCI, for the wonderful opportunities in the CVI Awareness Month to share my experience where I am expertising. Thank you so much.
Thank you so much. Okay, Dalia, if you don't mind, we'll take the last question. If you can stay for 1 minute.
Yeah, sure.
Yeah. Okay, so Pratiksha is asking, how do you deal with the constant headaches while performing therapy? Because whole day they are in a dark room and just a
I'm,
small space of light, so it's a constant line stimulation. So
I'm sorry, I didn't
how do
get the
you
question
how do you
actually.
deal with the constant headaches during the therapy?
Constant headaches means if we are dealing with CBI or what?
In CVI patients, she's saying, because patients are in the dark room and it's just a small space of light, and so
No, actually, we are giving the therapy according to the how the patient's visual acuity is.
yes.
Patients have poor visual acuity, poor visual attention. If we are giving extra illumination and a different patterned background, obviously the patient's attention will be distracted. To reduce that one, we are giving a background like dark rooms and all. Once the patient will get an attraction or attention towards a single object in a black background, then slowly we have to improvise their background and improve. Slowly we have to increase the complexity also to understand the patient and how to differentiate the things from a distraction. So patient never feel like that a headache or something like that.
Okay. Okay, we'll end the session now. If you have any questions, I will. Okay, Dalia, could you please type your email address so those participants who have questions, they can reach to you in email.
Yeah, sure.
So thank you so much all for joining us today. Lovely questions, lovely audience we've got today, and of course we've got a lovely, amazing speaker. So thank you all. If you have any questions, you can send it to Dalia directly. Take care, and we'll see you in the next session. Thank you all.